Now another infection, that is toxoplasmosis in pregnancy. Many questions were asked from this topic, including the management part, the etiology part, the complication part, life cycle, etc. So, what is toxoplasmosis? Toxoplasmosis is a condition which is caused by Toxoplasma gondii. It is not a virus, it is an intracellular protozoa affecting fetus via placenta, and it occurs due to the consumption of undercooked meat which has cyst of Toxoplasma gondii, cat feces which contains the oocyst, and contaminated soil and water. Uh, so these are the transmission factors responsible for toxoplasmosis. Primary infection during pregnancy can cause risk to the fetus, where mother can present with flu-like illness like all the illnesses, and usually asymptomatic lymphadenopathy can occur in the mother. Now coming to congenital toxoplasmosis, it has a classical triad of hydrocephalus, diffused intracranial calcification, and chorioretinitis. So can you see this? There is the presence of calcifications, and these calcifications are diffuse. They are occurring anywhere in this CT image. And there is ventriculomegaly also, that is the size of the ventricle is increased. And this ventriculomegaly is leading to hydrocephalus. So hydrocephalus, that is, you can see a swelling in the head of the baby. So this swelling can occur. Baby can manifest seizures. There is SNHL or sensory neural hearing loss. There is hepatomegaly. There is blueberry muffin rash, which we have seen in cytomegalovirus and rubella, and they are more specific for rubella. So chorioretinitis is also the feature, and there is diffuse intracranial calcification. So, congenital toxoplasmosis, pathogen is Toxoplasma gondii. Transmission is through cat's feces and undercooked meat, and transmission is transplacental. Serological testing and PCR of spinal fluid is used for diagnosis. Treatment is pyrimethamine and sulfadiazine. Folinic acid can also be added. Maternal screening and exposure avoidance are the prevention methods. Another image, here we can see that there is these calcifications. Can you see these calcifications? Yeah. And there is dilatation of the ventricle, lateral ventricles, which is causing hydrocephalus. And there is infection of this structure. I think this is falx cerebri. So there is hydrocephalus, there is purple blue marks, intracranial calcifications which are diffuse, and chorioretinitis. So the risk pattern, as similar to other two conditions, first trimester carries low transmission risk, where severity is more if infection occurs in the first trimester, means early infection causes more damage. And third trimester, transmission is high, but the severity is mild. So for diagnosis, we can do Toxoplasma, IgM and IgG in the mother, and if IgG is present, we can diagnose it with avidity test. Low avidity means high risk of transmission, and high avidity means low risk of transmission. Then in fetus, PCR from amniotic fluid can be done. Ultrasound may show hydrocephalus, calcifications, and IUGR. So the management part includes, if maternal infection is there before fetal infection is confirmed, then we can advise the patient spiramycin, which can reduce transplacental transmission. And if the fetus infection is confirmed, then we give a combination therapy of pyrimethamine, sulfadiazine, and folinic acid. Pyrimethamine is not given in first trimester because it is teratogenic, so we can alternate the therapy with spiramycin followed by pyrimethamine, etc. For prevention, avoid undercooked meat, wash vegetables properly, avoid cat litter, and wear gloves. So, for examination point of view, what points you have to remember? That there is association with the triad hydrocephalus, chorioretinitis, and diffuse intracranial calcification. Drug of choice is spiramycin, and definitive therapy is through pyrimethamine and sulfadiazine. So, this is the thing.